Hello, and welcome back to the Align Your Glow and Soul podcast. I am so excited. Today, we've got Emily on the podcast, who is a mental health or maternal health postpartum doula. So, today, we're going to fill your ears with all things fourth trimester, prevention, mental health awareness, and really just how to take care of you and yourself as a mom during and after your pregnancy. So, Emily, so excited to have you. Welcome on.
Thank you. I'm so excited to be here.
So, my first question from all my guests is, how do you align your glow?
I align my glow with trying to, I think, get me time
Mm.
as much as I can. Being a mom, being a business owner, and a caretaker, I often, like most caretakers, don't think of myself. So, one of the things that I've really been trying to incorporate into my daily routine is some me time of some sort. Whether it's like take a bath, I like to do like tarot readings on myself. It's just like a form of meditation for me. So, journaling, I try to just take some type of time and just focus on myself.
Oh my goodness. Yay! I love it. I love it when people say that. And I think it's critical for your mental health. So, perfect.
Mhm.
So, tell us a little bit about, and you can make it as detailed, short as long as you like, just about
Mhm.
your journey. What made you decide to become a doula? How long have you been practicing? And just any info you want to talk about, really about kind of your mom journey as well.
Yeah, so I had my first child in 2012, and I almost died when I had him. I had a postpartum hemorrhage about 12 hours after I delivered. Luckily, I was still in the hospital, but it was one of those things where they had tried everything, and they could not get the bleeding to stop, and they weren't sure why. So, I didn't know till after how close I came to dying, but my recovery time was way different than a normal vaginal delivery. So it was more like a C-section where I could not do much of anything by myself for the first 6 weeks, which was really hard because my husband had to get right back to work. Breastfeeding was super difficult with my son. So it was just this storm of just my perfect little bubble of how motherhood was going to go and how delivery was going to go was completely shattered.
Mm.
And it left me feeling really inadequate, especially when I had issues with breastfeeding. I felt like, oh, I can't even do this right. Um, so I kind of snapped out of it around like 3, 4 months, to where I was feeling better and more secure in my new role as a mom. And then 2 years later, I had my second. Well, my entire pregnancy, I was terrified that I was going to possibly die again or, hemorrhage like I did the first time around. And all the healthcare providers that I worked with, all the doctors are like, oh, that was a fluke. It was because he was a big baby. You were induced. It was this, it was that. So nobody took my fears seriously, which caused me severe anxiety my entire pregnancy. To the point where I wanted them to induce me or possibly do a C-section just because I wanted to have some type of control over when I went into labor. So I ended up having her. I did bleed really bad again, but since they knew it was a possibility, they jumped on it right away. So I did not bleed nearly as much. And my recovery time was shorter, but I still had unresolved trauma from the first time around. So by the time I hit 3 months postpartum, I was really feeling down on myself. I actually went in and saw the psychiatrist, and they told me it was actually late. This was coming up late, me having any type of depression or anxiety. This is kind of late for it to be coming up. So I was like, oh, I can't even have depression right. Like, I'm so horrible that I can't even do this right. So they're telling me that, like, oh, it's got to be something else. It's not postpartum. It's not this. So I did end up getting some therapy and working on some things, but it still did not feel like I actually addressed anything or solved anything. It just felt like putting a band-aid on it. And then once I was far enough postpartum into my postpartum journey, like a lot of the stuff went away. So it was okay. So when my third came around, or after my second, that's when I started looking into support. And I was like, there has to be some type of support for women in postpartum. And I actually was watching an old episode of the Gilmore Girls as I was breastfeeding my daughter. And the character Suki, and it had a postpartum doula. And I had seen this episode like a dozen times, but it never triggered in my head. And I was like, I knew what a birth doula was. I was like, I don't know what a postpartum doula is. So I Googled it and I was like, oh my gosh, this is my dream job. I get to help support moms and I get my baby fixed. I'm like, how have I not known that this is a thing? Well, I quickly realized that in Colorado, it wasn't a thing. I had to go to North Carolina to get my training because the other option was California, but it was going to be like 6 months later. And I was like, I want to go ahead and do the training to see if this is the route I want to go. So it's a newer thing in Colorado. I actually brought training out here last year through the organization Dona International that I'm certified with to help get some more postpartum doulas out there. So that's how I, stumbled upon it. And I helped a couple different families through, once my daughter turned 4 years old, I had another baby. So 3 years later, I had another baby. And then after she got a little bit older is when I really started to dive into my doula work.
Oh my gosh. Thank you, Gilmore Girls, for
I
inspiring
know.
me. But thank you for sharing too. I mean, that, it can be devastating to endure any sort of traumatic experience, let alone giving birth. And that's, what we're going to talk
hmm
about, I think, a lot today is just
hmm
doesn't need to be a big trauma. It can be, but
hmm
even a little trauma, that you tear slightly can be traumatic and impact you for
hmm
life. And the fact that your doctors aren't
hmm
even listening to you about even validating your like valid emotions and experiences is just, it's sad. And it's,
Yeah, I felt so unheard. I'm
mhm,
like, okay, I'm just blowing this out of proportion. Like, it made me feel guilty, and then it made me stop talking about my fears.
mhm.
And I think that really led me to kind of draw into myself. And I actually did not feel like I bonded with my second during pregnancy the way I did with my first. So when she came out, it was like I was so terrified to get close with her because I was possibly going to die that it took a little while for us to feel like I developed that bond with her after birth.
Oh my
And
god.
then I felt ashamed for that because I'm like, oh, my first son, like, it was instant, like, and I was like, everybody tells you, like, the moms feel it right away. They're bonding with their baby. Dads, it's okay to wait till baby comes. That's when they bond with the baby. And it's like, not everybody bonds with their baby when they're pregnant. It is a process.
Right. And every experience is different. Every pregnancy is different. Every
Mhm,
mom is different. Every birth is different. And I think we need to recognize there is no quote unquote normal way to
mhm.
endure a pregnancy, to give birth.
Yep.
Everybody's going to be different. And,
Yep.
there's guidelines, there's recommendations, there's statistics, but take those with a grain of salt. If you don't fit into that niche, there's something
Mhm.
wrong with you.
Yeah, and that's one thing that I really try to work with my birth clients specifically, but also postpartum, is to have realistic expectations. Because if you don't, you can have this elaborate birth plan, that's great. But if it's not realistic to what can happen, you're just setting yourself up for being disappointed. And like you said, big trauma, little trauma, our bodies see it the same way. It doesn't matter.
Mhm.
So no matter what, we're still going to have the same physical responses that we would from a huge trauma versus a smaller trauma.
Right. And we can't compare traumas. Let's just say that too.
No, no, exactly. Exactly. Trauma is trauma. It doesn't matter what it is, it's still trauma.
So, let's talk about, since you mentioned it, birth plans, because I never
Hmm.
really heard of this idea until I started, getting into filling my brain with as much knowledge as
Hmm.
possible. And first of all, I love the idea. I think every
Hmm.
single person that gives birth, every mom should have this because it really helps you try to have as much control. And obviously, birth
Hmm.
is birth, and the baby's gonna do what the baby's gonna do, and your plan might go
Hmm.
out the window. But I think it's great to
Hmm.
have one. So, what would you recommend for your clients? Should they have a plan A, plan B, plan C? How do you guide them to create one?
I kind of have them just think of kind of all possibilities. And sometimes unfortunately, you have to plan for the worst too. That way that when it happens, you aren't so caught off guard. And I do this with postpartum with mental health as well, that we have kind of a roadmap to take if things start to go off the rails. So if there is going to be a C-section, how do you want that C-section to go? Do
Mhm.
you want to try to do skin to skin? Do you want a drop cloth where you can see through and see baby come out? So that if these things happen, even though it may be an emergency situation and it's out of your control, there might be still small elements that you can feel like you contributed and have choices and options in.
Yes, I love that. What
And
are
nobody knows how they're going to respond to the pain of labor. I
some
mean, I have gone into natural labor and I've been induced. It's two different types of labor. So, even if someone is very dead set on having any type of intervention as far as pain medication or pain management, other than, just hands on natural, I just let them, I try to get them to research it and know the facts so that if they have to go down that road, they aren't like freaking out that, oh, my baby's going to be drugged. This is going to be harmful. This is going to be that. So I love the website Evidence Based Birthing. They have all the research done on huge, very different topics that go into labor and delivery, postpartum, kind of everything. So I tend to go to there for a lot of my research based articles so that people know, okay, this is scientific, scientifically backed and everything, just to try to take some of that. Oh my gosh, I said I was never going to do this. And then I did it. What's going to happen to my baby?
I love that you try to provide your clients with informed consent. I think that is very
Mm-hmm.
important. So, when you're cultivating your ideal birth plan, what are some things you wouldn't even
Mm-hmm.
think about that you would want to put on there?
Distractions. Um, do you like watching movies? Do you like playing board games? Do you like just surfing the web, social media? Anything that can kind of distract you and that you enjoy doing can be really beneficial during labor.
That I have not even heard of that. That's a great one. Um,
Hmm.
what are some good natural ways you can manage the pain other than, breathing obviously super important, but what are some other
Yeah.
cool tips and tricks?
Hypnosis, kind of guided trance hypnosis, can be really beneficial. You do have to start that on the earlier end. It's not like you can just do it when you walk in for labor because it is kind of meditative. So you have to learn to kind of really focus on that and be able to access it. And it's not for everybody. Not everybody can do that. I also really like the use of, some women love it, some don't, but like a Theragun type thing, or a massage gun.
Mhm.
Some really like it, not even necessarily on, but your partner is able to push it in really hard. And they don't get as tired as like holding a tennis ball or something like that and constantly trying to get it into your back. I also love the use of sitting on the toilet. I know it sounds
I've read that
crazy,
actually.
but it really helps you progress, and it just takes off some of the pressure on the rest of your body and lets gravity kind of do its thing.
That is so funny. I'll have to find her information, but it's a doula in, I want to say, Australia. And she just
Hmm.
posted that recently, why you should sit on
Hmm.
the toilet. And I was like,
It really is amazing. Like it really does. And even some of the nurses in labor and delivery have said to me, they're like, yep, that's the, when we have people that are not progressing, that's what we do. We say, let's go sit on the toilet.
fascinating. But it does, I
Mm-hmm.
have learned, I've interviewed, chiropractors and physical
Mm-hmm.
therapists, and they talk about just that pelvic floor and really being able to
Mm-hmm.
open it up, stretch it out, relax that
Mm-hmm.
entire system of muscles, because if it's tense and tight, you're going to have a really difficult time.
Yeah, yeah, yeah. The other thing I really like too, is to ask them, especially if they've had like intense menstrual cramping like throughout their life, how do you deal with that pain? How have you dealt with that throughout your life? Because I mean, some people when they're in pain, they want to sleep. So if we can get to the point where we can get you comfortable enough, especially in early labor, to get you to sleep, that's one way that you can really progress because your body is in that relaxed state. So I try to go back to what worked for you when you're in pain, when you've been in pain in other ways. Like, what are your go-to, you know, do you jump to grabbing Advil and Tylenol, or do you try other things like heating pads, baths? Like, what has helped you in the past as well?
But what a great, like, you wouldn't even think of it, right? Like, what have you done? Let's not reinvent the
Hmm.
wheel here.
Hmm.
I love that.
Yeah, because we handle pain throughout our lives. So, what is your go to for doing that? Because everybody has some type of pain that they've dealt with, and
Mhm.
it's okay. What has helped you?
I love that. Um, what are some things that you should take, whether I guess you want to include this in your home birth, but if you were going to go to
Hmm.
a birth center or a hospital, what are some must-haves that you should put in that hospital bag?
A sound machine.
Ooh, okay.
Yes. Hospitals specifically are so loud and
Mhm.
they're coming in all the time. There's lights, there's bings and pings and all sorts of stuff going off. So, a sound machine, or earplugs, whatever works better for you. A lot of times I say sound machine because that also can soothe baby too. Um, so it can make it a little easier. And then a sleep mask
Mm.
because they are turning on lights, and a night light because the light situation in hospital rooms, there is no like soft light.
Oh, yeah, it's
It
bright.
is
It is sterile and light, right?
ridiculous. And my favorite thing for postpartum for a baby registry is a salt lamp, like the Himalayan pink salt
Mhm.
lamp. You put a red light bulb in it. You can turn it up really bright, but it doesn't stimulate the way blue or white light or other colored light does. But you can still get things done. You can still see for changes, for nursing, for all that other stuff without turning on a light that's going to cause stimulation to anybody.
Yes. Oh, I've read so much good things about having red light instead of, these very bright, just not
Hmm.
good for your eyes at all. So yes, love that.
Yeah, yeah.
So with that postpartum product in line, what else would you
Hmm.
say? Maybe you wouldn't even know. Like I've read what frozen pads that are great to help
Hmm.
just,
Hmm.
feel better. But what are some
Hmm.
other great
And
items you say?
some people they love them, some people they don't. It actually depending on how frozen it is. It can kind of
Mhm.
be, especially if you have a tear, it can be a little intrusive. Um, but I do recommend lots of pads, lots of big pads. Steel, not steel, because you're paying for them in the hospital specifically. Take as many hospital pads as you can because you can't buy ones exactly like that, like
Mm.
at the grocery store. They
Okay.
are different. Even like the heavy duty ones, they still are different. They don't cover as much, and they don't hold as much either. So definitely take as much from the hospital as you can and those undies. Um, I know we're trying to go greener, but postpartum is not the time to go green. Uh, buy disposable stuff. You don't want to have to be washing anything more than you need to.
Mm,
So for the first, even if it's just for the first couple weeks, like I just anything that you have that you can just toss it because it's just so much easier.
right. You got a lot going on that postpartum
Mhm.
era.
I also really like on Amazon, they have like the hospital gowns, like the birthing gowns
Mhm.
that are a little cuter, but the access that they have up top is perfect for putting baby in and doing skin to skin
Mm,
without having to like really take clothes off or do anything like that. And they kind of fit in like a pouch really easily. So that's one of my go-tos for like the first week, especially with breastfeeding, because it makes it so easy to just pull it down, but you don't feel like you're necessarily exposed. You can easily take it back up. So that's one of my like I guess less suggested items that I've seen from other doulas is a hospital maternity gown.
okay.
So, in a nice robe set, nice PJs that you're comfortable in. Just if you are nursing, make sure that you have easy access because you don't want to have to be dealing when baby's hungry, and you don't, when you're learning to breastfeed, it's a process. It's not, they say it's natural, but there's a learning curve.
Mhm.
Even if it is natural, there is a learning curve, and you don't want to have any added stress. So just being able to whip things out and do what you do really quickly, it makes it a lot easier.
Which again, you may not even realize and think about. So love
Mhm,
that. And I'll
mhm. They
put
have all this cute, like, nursing stuff, but it's not necessarily the most functional for when you're starting your nursing journey,
mm,
because a lot of it is once you've gotten it down, baby has a little more head control, like, you don't have to look at baby, to make sure they're latched properly. So a lot of the things that kind of drape over aren't necessarily the best for when you're starting out the breastfeeding journey.
oh, very good to know. I'll put together a list too. If you're listening, you're like, what did she say? I'll have it in the show notes. So
Yeah, sorry.
cool.
And the last thing is, and I mentioned the salt lamp. That is one of my go-tos that I say to put on the registry is the salt lamp because they make diaper changing, feeding, everything. You can sleep with it on if you really wanted to, and
Mhm.
it won't disturb you or baby or partner. So I definitely something with a red light. The salt lamps, they're pretty, they look a little nice. You can use them later on. Um, and then also a huge water bottle,
Okay. Like to
huge
take
one.
to the hospital?
Afterwards,
Okay.
they give you some pretty big ones in the hospital, luckily. And if you ask for more, they'll give you more. But once you're home, even if you're not nursing, at first you are so thirsty all the time.
Oh, okay.
And one of the things that I say, sometimes it's better to have two. So if you have upstairs and downstairs, keep one upstairs, keep one downstairs, because you don't want to, when you're tired in the middle of the night and you're super thirsty, you can just fill it up in the sink or something, or have bottle, whatever your preferred method, have a jug of water or something. But to keep you from being like, where's my water bottle now? Just have two of them and just put them in two different places so you always have water.
Smart. Again, yes, love that. So let's transition over to
Okay.
the fourth trimester. It is, something you're super passionate about, and just that maternal mental health doula
Mhm,
knowledge and services. You've been doing this for 6 years.
mhm.
Why focus on maternal mental health and getting these women who are in this time frame support?
Well, one of the things is we have learned that 1 in 7 women are experience postpartum mood disorders, depression specifically. Um, Post pandemic or still in pandemic, whatever, that number is going to rise.
Mhm.
Um, we're going to see a lot more. We have seen a lot more. So the statistics are kind of outdated, obviously. And then also 20% of pregnant and new moms experience some type of maternal mental health disorder. Um, those numbers don't have to be that bad.
Mhm.
It doesn't have to be like this. The majority of the situations are preventable. Um, Having the right support, we have found, is one of the biggest things at preventing postpartum mood disorders.
So let's just say new mom, right? First
Mm-hmm,
pregnancy. She's excited, so joyful to carry, and really doesn't even know, some of the things that can occur once you have
mm-hmm,
a child. Um,
mm-hmm,
what would you say to her? Who should she have on her care team? And what are some preventative measures she can have so
mm-hmm,
she doesn't become a statistic or doesn't, find herself in a position where she's struggling to get up every day or she doesn't feel
mm-hmm,
like she's bonding with the baby or she doesn't feel like she's a normal mom?
mm-hmm. I think a lot of it is sharing the reality of motherhood. It is not this rosy, pink glasses, beautiful, amazing thing all the time. You can still love your child and hate being a parent some days. You can hate having to get up in the middle of the night for that 15th diaper change. It is okay and it's normal. These are normal feelings, but nobody talks about it. It doesn't make you a bad mom. I think having someone that you can talk to um, and feel 100% comfortable and not judged is one of the biggest things. Um, because you have to have someone that I always say that you can have as much support, you can have all the support in the world, but if it's not the right support, it's not going to help. I, for instance, I had my parents, my mom, I love her, everything. I had so much help, but it wasn't the right support. I needed someone to validate my feelings, to tell me that, not just be like, oh, you're having a bad day. At least the baby's healthy. At least you're alive. And that's just kind of, first of all, that generation. And then also that's kind of our go-to with people, is instead of being like, well, yeah, that sucks, I'm sorry, like that's got to be hard feeling like that, we just try to pep them back up. Well, look on the bright side. Well, you know what, you gotta work with what you're working with, and if you're feeling down in the dumps, you need to be able to voice that and not feel judged or shame.
Shame. All
Mhm.
my mom friends have experienced it in some level, and I mean, I don't what why do we go through this roller coaster of emotions?
I think a lot of it is because the way we view emotions. We
Mm,
view emotions are as good or bad.
mhm.
Emotions are not good or bad. They are neutral. The behavior and the reaction to them can be good or bad. If you're feeling anger and you walk up and punch somebody, yeah, that's a bad reaction, but the anger is not bad. The anger is normal. It's an emotion. Yeah, it's not good or bad. And I think we put so much into our emotions being good or bad that when we feel emotions, that's where the shame comes in, because we're bad for feeling those emotions.
Oh my goodness, you nailed that. I would agree 100%. I think that's a beautiful explanation, and, it's just something we all have to learn how to rewire our brains and stop this, like,
Mhm.
"Oh, I feel bad," or "I'm like, this is bad," or "This is good," and you're absolutely right, if you have ever and I've talked about this in previous episodes, please look up the emotional frequency scale, the Hertz emotional frequency scale. It talks about the frequency
Mhm.
of emotions, and nowhere on there does it say that these are good or bad. Just talks about
Yeah.
lower emotions and higher emotions, and we're gonna
Mhm.
feel the low ones, and there's nothing wrong with you, nothing at all.
Mhm.
And it's just
Mhm.
realizing if you feel like you're getting stuck in these lower emotions, how can you get some support? How can you get them help? As you said, how can you talk to
Mhm.
somebody? And it's not your best
Mhm.
friend. It's not. they're
Mhm.
they're in your life for a different reason. They're not there to, unless you're a counselor, they're not there to
Mhm.
guide you through and diagnose you, and, they just don't know. They're not trained. They don't have the, experience or really the, tools to provide you with. So,
Mhm.
yes. What are, I guess, some ways someone could tell if they need some support, whether it's a postpartum doula like yourself, or maybe even a psychiatrist or a therapist? What are
Mhm.
some I guess um pinpoints before they get to really a crisis situation?
Mhm. I think one of the biggest things is to be realistic about how much sleep you need, because you're not gonna sleep much which baby's here, and if you're a person that has to get 12 hours of sleep for you to function, that's okay, but make sure we're setting up, um, grandma coming over so you can sleep, some way to make sure that you are getting chunks of sleep, because that is going to be one of the quickest ways to go down that rabbit hole, when you are feeling bad. If you are, I have clients all the time that are super overwhelmed when I walk in the door. After getting them some sleep, they feel a lot better. We talk about the same stuff and it's like, oh, okay, you just see it in a different light, maybe. So I think making sure someone gets lots of sleep, adequate nutrition, because you are healing. Your body is healing from 9 months of literally this lovely, beautiful baby stripping your body of all the nutrients that you have basically to grow, which is great, but you need to replenish that. Um, that can also be some of the factors that lead into some of these, the mood disorders and feeling really, really just crummy, low energy, not wanting to get out of bed. But if you continue to really struggle and feel very overwhelmed and not enjoy anything about your new transitioning life, that's when I really say, okay, we need to have a little sit down and let's talk about what we can do to get out of this because it doesn't have to be that way.
Oh, yes.
I hope that made sense. Sorry.
Yeah, that was good. I think, I've heard this from many people now, is sleep. I mean, and we are so focused on the baby and the baby's needs, and sorry, but
Mhm.
mom needs sleep too. There are
Yes.
mom needs to be the priority just as much as the baby, and they both can be
Mhm.
the focus of this time frame. Um,
Mhm.
what are some
And I
common—
think that's what's wrong with our culture too. Sorry for interrupting,
No,
but
perfect.
we just, but everything is focused on the baby. We
Mhm.
forget about mom. Mom just went through this life-changing experience too and transformation. She needs to be taken care of as well. She needs to be nurtured, just she needs to be baby just the same way. And I think our culture of get up, bounce back, keep going is really toxic. And I think that's another way we build shame is because, oh, well, that person was out like running 6 months after, like ran a marathon. Like, why am I still trying to lose this baby weight? And, I think we just, as a society, we set moms up to fail. We
Mm.
really do.
Oh my gosh, yes. And I would say, and I'll probably write this down as my own advice when I get pregnant, is don't get on social media postpartum.
Oh my gosh. Yeah. Yeah.
We just sit here and compare. I mean, we already do it, right, in normal life,
Hmm.
whether it's consciously or subconsciously, and then take, your very fragile mental state, right? You've got emotions flying
Hmm.
up and down. They're trying to regulate. Your body's trying to get back to, and I don't want to say normal. It's not the right word. We never get back to
Hmm.
normal,
Hmm.
but recover. There
Hmm.
we go. That's a better word.
Hmm.
Um,
Hmm.
and so you don't feel great about yourself, and then you're looking at all these women and their beautiful like postpartum stories that, let's be real, probably are not the real situation.
Yep, exactly. And that's like because most of the time when moms start getting on, it's the 3 a.m. feeding. You're trying to keep yourself awake. So you're just scrolling and you're spot on. Like that is the most toxic environment to someone who is feeling emotionally vulnerable or not adequate. Um, to go on and look at those things. Yeah, that's one of the things that I really tell moms too. I'm like, okay, I'm going to send you some stuff. Like, I'll send them videos to look at postpartum if they're wondering about certain stuff, but I make sure it's a realistic one, or, like, I make sure it's not just the Instagram or Facebook version, like it's actual reality based.
Yes, and follow pages that are real, like, they're talking about just the reality, I've followed
Hmm.
recently followed all these beautiful, like, natural kinda mom pages, and I saw a post today, and it was this woman who was either, like, like, postpartum, like, fresh postpartum, breastfeeding her child, like, your stomach still looks like you're pregnant, like, your boobs are
Hmm.
not gonna be perky and perfect, and it talks
Hmm.
about how can we normalize post-birth bodies? There is nothing wrong with
Hmm.
them. There's no such thing as bouncing back. Let's just take that out of the equation.
Exactly, exactly. I really like Ashley Graham.
Mm,
Um, she has put up, since she's had her babies and everything, she's put up tons of more realistic photos, and she's showing her postpartum body and embracing it. And it's just so amazing to see a celebrity model doing that and not just hiding behind a corset, or doing everything they can shapewear to hide their postpartum figure. And it's like, no, your hips change, your body changes, like embrace the new you. And it's easier said than done. You have good days and you have bad days, but yeah, seeing how toxic of a message that's out there about postpartum bodies and the way you should look, the way you should feel is just, it's so devastating that we do that to people.
yes. Um, okay, let's finish with what are some, let's just say 3, and if you wanna add on more, absolutely, but
Mhm.
what are some 3 tips that postpartum moms can incorporate in their postpartum routine once they maybe have some sort of routine to help maintain
Mhm.
really good mental health?
Shower.
It's a good one.
Take a shower. It will make you feel a lot more human. You're going to have milk, formula, poop, everything under the sun. Like, you're going to have liquids all over you all the time. So being able to take a shower um, really can help just kind of lift your spirits. And then also, not only just taking a shower, but taking a shower that you can enjoy while someone else watches baby. Don't try to beat the clock before baby starts screaming. You are going to hear phantom screams all the time. Anytime you get in the shower, even with my kids being as old as they are now, I still get in the shower and I'm like, oh, is someone calling me?
Mhm.
So take that pressure off and have someone sit with baby if possible, partner or somebody, so that you can actually enjoy your shower. I think another thing would be, do something every day to focus on yourself, even if it's just washing your face, putting on your moisturizer, putting on, your favorite lotion, lighting your favorite candle, just something that's for you.
Yes, I love that. Any other best practices, tips and tricks, really, ways to just be as healthy as you possibly can be during that time frame?
Honestly, I think the biggest thing is support.
Mm,
Having a good support system set up, so that if you need more sleep, if you're having a rough day, and just, new moms, you have times where you don't want to be touched. Like, you're touched out. You have baby, your body is not yours anymore, especially if you're breastfeeding. Like, they belong to baby. So dealing with that can be very overwhelming. So having a good support system so that when you are feeling overwhelmed and need that break, you can get that break. Um, preferably it'd be a non-judgmental support system so that you the narrative is not, "Oh my gosh, well, you're passing off your baby again to me. Like, what are you doing? Like, I just had him yesterday," or anything like that. Having a good support that is empathetic to what you're going through and realizes that you do need time for yourself and you do need to take care of yourself to be able to take care of your baby.
Yes. Mm, I love that. Thank you for sharing that information. So, Emily, if people are listening, they're like, "Oh my gosh, this is amazing and beautiful," and maybe they're pregnant or they're gonna get pregnant and they want to hire you and work with you. What services do you offer? And um, you know, something I didn't think about until I started doing my own research. How far ahead do they need to think about if somebody wants to hire a doula?
Mhm, mhm. That's a good question. So, um, I do birth, postpartum, um, newborn care, which is what it used to be referred to as night nanny or whatever. And then I also offer maternity concierge, which, if you think of it, it's kind of like a wedding planner, but for baby planning. So, kind of anything and everything that can come up during that process, I can walk you through it and be your go to with helping. Um, with anything, literally, the spectrum of stuff that comes up. Um, as far as planning out, for birthing, I'd say try to at least by 20 weeks, try to get a doula lined out just because depending on the doula you want and how many clients they take on during a certain time, um, they may be booked up. I personally, I only take on one birth client at a time for like a month period. And then postpartum, I take 1 to 2. I try to leave myself open for emergency situations. If someone has had a really traumatic birth, doulas know to kind of reach out to me
Mm,
so that I can help kind of assess the mental health and the trauma and kind of figure out which direction we need to go with care. So I try to always leave myself open for emergency situations. But for postpartum, I mean, it's hard. Some people, I'll get a call when baby's 2 weeks old and they feel like they're drowning and they want help. Um, Planning out ahead of time is obviously better because just like anything else, if like especially sleep deprivation, if you can get on that before it becomes an issue, we're not playing catch up. So, especially for people who have multiples and stuff, I always say, like, let's do preventative care here and let's have me start right away so that you're not getting way behind on sleep to where, me coming over and doing care is not going to do much because you're so behind on sleep and you're so tired, so exhausted, so overwhelmed. So, I think kind of if you can start it right away and plan for if this
mhm.
happens, it's the best course to go.
I love that. And where do you show up the most to, just educate the world on all of your experience and knowledge? Are you on Facebook, Instagram? What's your favorite place?
Instagram is where I'm on most. I've been really bad about posting lately, but I'll get back into it. I was really busy over the summer with clients and everything. So, and in the fall. So I just kind of fell off. But that's where my contact info, my information, everything will be up to date more than anything else. I'm getting ready to switch over my company name and rebrand. So I'm going to be, instead of my doula, I'm going to be Simple Beginnings LLC. So my website will be down. So Instagram is definitely the easiest way to get a hold of me right now.
Lovely. I'll, as always, have that in the show notes. Easy to find you.
Mhm.
So thank you, Emily, so much for just sharing really all the things. We could probably continue on forever and ever, but we'll leave it, so people can get the gist. Really appreciate just, your passion to support women in their postpartum journey. Thank you for doing, clearly you're doing what you love and it's beautiful. So thank you.
Thanks. Thanks for having me. Yeah, I absolutely I found my calling for sure. I absolutely love it.
Awesome. And if you're listening, I say it every time, I'll say it again. If you got anything from this podcast or think that anybody could benefit from it, share the episode. Send it to a friend who maybe needs to hear it, or take a screenshot and share it on Instagram and tag us. So thank you again, listeners, and have a magical day.